Good afternoon, everybody. Tom Dermody here, Mayor of the City of LaPorte, with a special, I apologize, last minute AMA, Ask Me Anything. And we have a special guest today, Dr. Christina Box, Indiana State Health Commissioner. With everything that's been happening regarding COVID, vaccinations, this is your opportunity in LaPorte to ask directly the state health director your concern, your question about anything related to COVID, and most importantly, with the vaccine. Welcome, Dr. Box.
Thank you, Mayor Dermody, and thanks for having me on. I think this is such a great opportunity to be able to talk to your public and your community and talk about the vaccine and the hope that it brings to your community and to the entire state and the United States.
Well, and thank you for setting up through the state and through FEMA what we're calling Operation Vaccinate LaPorte at the Rural King on the west end of town. And the best part of this is it is a drive up. You can register ahead of time, but if you feel like that you just want to drive up, get a vaccine, all you have to give is your name, your date of birth. You do not even need to show confirming identification, and you can get your first of 2 Pfizer shots Tuesday through Saturday, 9 a.m. to 6 p.m. And I'll tell you what, LaPorte's showing the state how it is up here. In the first 2 hours, we've had 177 vaccinations. So thank you. And Dr. Box, is that a good number? 177 in the first couple hours?
Absolutely. I think for the entire day, we've got 450 to 500 allocated. So you guys are well on your way to using those up, and we will bring more if we have to. We just want to keep immunizing, keep getting vaccine in arms.
Well, great. Let's get right to the questions because I know we've only got a short amount of time with you here. You're very busy. Why should people in general be vaccinated?
Well, Hoosiers have lost nearly 13,000 individuals to this disease. And even though we have some people who become minimally ill or even are asymptomatic with the infection, we do have many people that have very severe consequences from this. And even individuals that you might not expect, sometimes are very young individuals. Oftentimes, individuals that don't have severe cases can even have some long-term consequences with their heart and their lungs from this. So we can't really predict on an individual basis who is going to have the significant issues with it. But we definitely want to make sure that we protect every Hoosier that we can. And these vaccines are so safe and so effective at preventing hospitalizations and deaths. I mean, like 95+% at preventing hospitalizations and nearly 100% at preventing deaths.
So Indiana made news along with the government, federal government today. Indiana is putting a pause on the Johnson & Johnson one shot. And I know for those that are concerned about vaccines, that automatically says, oh my gosh, see, I told you so, don't get vaccinated. But I think Indiana, again, is being proactive. Can you explain exactly what happened with the Johnson & Johnson? Because from my perspective, I think there were 7 cases or so out of 7 million vaccinations.
Mm-hmm.
The percentages are very good.
Yeah, it's really concerning. Obviously, these are all brand new vaccines. So we're watching all of the adverse effects of these vaccines, anything that's reported very carefully. I think the important thing is exactly what you said. We are putting a pause, the state of Indiana, in concert with the CDC and the FDA on giving the J&J vaccine at this point in time. I think that we'll very shortly be back to giving it again soon, but this pause gives our healthcare providers across the state gives us time to educate them about what has been seen and the severe adverse effects only seen in 6 individuals, as you say, out of 6.8 million J&J vaccines already given here in the United States. If you're one of those individuals or that's part of your family, that's 100% in you. And my heart breaks for that. But again, it's less than 1 in a million individuals. And it is an unusual clotting that has occurred in these individuals that in the veins that drain the brain area. And also a low, what we call platelet count, which is a part of your body's ability to kind of get your blood to clot. So those 2 things together, because they're unusual, I think the CDC looked at that and the Vaccine Adverse Effects Reporting System looked at that and said, and it's acting exactly the way we want it to, right? It's picking up anything that's unusual or out of the norm, and we're putting a pause based on it so that we have time to look into that further.
But that still leaves Pfizer, Moderna. Pfizer allows 16 years and older if you have parental consent. Why should people still feel safe receiving the Pfizer or the Moderna shot?
Well, I think we have to remember that we have been giving the Pfizer and the Moderna vaccine now since mid-December, and we've been doing that very safely. Those same type of adverse effects reporting system has been in place for these mRNA vaccines, and we have not seen these kind of reports with them. In fact, of all the 3.5 million doses essentially that we've given in the state of Indiana, only about 3.7 of them percent of them have been J&J. So most of them are actually Pfizer and Moderna. We have great experience with that thus far. So
So
what I would say is this is a very, very safe vaccine. The Pfizer and Moderna have been well studied, and we have real world evidence of how it has prevented hospitalizations. It has decreased infections, decreased deaths, and decreased adverse effects. So we really want to make sure that we get this in people's arms.
So Nikki Blower Nelson, I appreciate her question. She says, we do not know what the long-term effect is. Are there going to be adverse problems 5, 10, 15 years from now? I mean, I'm going to put my two thoughts in there. I mean, we know we have problems right now with people that have received COVID, that have died, had severe issues. What are your thoughts regarding the adverse problems 5, 10, 15 years from now?
It's not typical that we see adverse effects of vaccines 10, 15, 20 years after they're given. Oftentimes, vaccines have to be repeated in booster doses or sometimes yearly, like our influenza vaccine. Normally, if we're going to see adverse reactions, we see them pretty quickly in that first few weeks to even a few months afterwards. So since we've not seen that with seen that with Pfizer and Moderna, we aren't expecting that. But I do know that there are concerns. I hear all the time, like one of our vaccines that we use for the human papillomavirus, HPV virus, there's a lot of talk about that causing infertility issues. And there is absolutely no evidence of that. In fact, we've got people already saying that about this vaccine, and this vaccine hasn't even been out long enough for someone to say that there could be infertility issues with it. So I like to address kind of some of those myths that are out there that people talk about that really have no basis in science.
And then part of the future effects, there's not enough study on it. It was rushed. And again, I think my comments I'll keep to myself. I'll let you, from a medical perspective, address that it was rushed. There isn't enough time.
Those are really good questions. You know, I think that never before in the history of health has public health and a pandemic and an infection been as studied and understood by the general public, along with the treatments as has the COVID-19 infection. But what I would say is that words like emergency use authorization, words like Operation Warp Speed have made people uncomfortable. But what people need to understand is that we actually didn't speed anything up about the normal phases of investigation that any vaccine would go through or any medication would go through before we presented them to the public. We just were very, very lucky in that when we had large outbreaks, many of these vaccines were being tested. So, and lots of people volunteered to get the vaccine, get the medication, which sometimes takes us years. So we could study it very quickly and see in our placebo group how many people got infected versus our vaccinated group, how many people did not get infected or die or be hospitalized from this. The other thing I would say is that in addition to doing those same phases of study and requiring those same numbers of individuals to be engaged and see the same number of infections so that we could compare the two groups, we also at the same time started manufacturing these vaccines so that if the studies did come out showing a particular vaccine was safe and effective, we would already have vaccine ready. So that's kind of how this has been sped up, but there's been no change in what is required from the FDA in order for an emergency use authorization to be completed. And the only reason it is not fully approved at this point in time, meaning that it's not under an emergency use authorization, is we haven't been able to study it long enough to see how long the immunity lasts from this, whether it's less immune response from our elderly patients or from other individuals. So there's just more studies that need to be done going forward so that the true recommendations with this vaccine long term can come out.
So this is good news. Katie Jarka just wanted us to know I received both doses of Pfizer vaccine and had zero side effects. I'm so happy to be protected now. And Jeff Gidley says, hey, I have different views, still love you. And that's the point. We are all in this together. This is not something uh, that we should be on separate sides. We're trying to provide as much information. I'm not saying mandate vaccines, but I'm certainly saying I want to get as much information like yourself that there's a good reason to be vaccinated, but it doesn't mean we should be attacking each other no matter what people do. We all are in this to make everybody as healthy and safety as safe as possible.
Absolutely. Everybody has the right to make their decision for themselves and for their children. We just want everyone to have the right information and the right tools. We want them to get their data and their decision making tools from things like our website at rshot.in.gov or from the CDC and not from social media, because I see so many inaccurate, non-scientific posts on social media.
Dr. Box, Joanna Johnson wants to know, do you have to wait the 28 days before the second Moderna? I'm due the 28th, but thought about going to the drive-through vaccine. First of all, Joanna, the shot at the drive-through is Pfizer, not Moderna. But your thoughts on waiting the 28 days and how, if that's important or not?
So waiting the 28 days to get the second dose, you mean?
Correct.
Right. So we don't want you to get it before the 28 days. The Pfizer's 21 days and the Moderna's 28 days. Even if you go as long as 6 weeks, so 42 days, it actually gets a little more effective at that increased time. But what we don't want is for you to get them too close together, because we want to rev your body's immune system up, let it calm down a little bit, and then bring it back again so that you have an enhanced immune response.
Mike Nelson would like to know, the numbers seem to indicate COVID doesn't affect kids to nearly the degree that even the flu does, but I'm not an expert. In your opinion, should children or those, let's say, under 20 get the vaccine?
Yeah, we still are seeing significant infections in kids. And the thing that concerns me the most is that we are seeing a lot more of the variants of concern. So that B117 variant that first originated in the UK is rapidly becoming our most common variant here. And we know that it is about 1.5 times more effective at transmitting from one person to another. And it also has an increased adverse effects of about 50% to 60%. So we don't know exactly how children will do with that. We are seeing more hospitalizations in our younger population now. We do have a very fortunately not very common thing called MISC, which is a multi-system inflammatory syndrome that some children will get after asymptomatic or very mild infections, which affects many of their organ systems in their bodies, and they oftentimes have to be hospitalized in the ICU. Thankfully, Indiana has not had any deaths from that, but it certainly has caused deaths in the United States. So certainly, I think that if we have the opportunity to protect our children, prevent the spread to grandma and grandpa and other people, that we should try to get them protected. We will already, we've seen Pfizer apply for the emergency use authorization for 12 to 15-year-olds. They're already, as you said, we can use them in those that are 16 and 17. So we're going to have a big push before the end of the school year here to have schools bring their kids out to sites or to set up sites on school grounds so that we can immunize as many kids as possible.
That's great. Jeff Miller says we're starting a very big spike in LaPorte County. Not to put you on the spot, but should there be a move up the ladder locally here to some more restrictions? Or at what point do you say, all right, we need to get back to where we were at some point? Because I think we're leveling around orange possibly. And so your thoughts there?
Yeah, I mean, I think that, the science hasn't changed. The same mitigation measures that have worked from the very beginning of this with regards to social distancing and wearing masks continue to work, and they work on the variants, which is really, really important. I think that we're just not quite ready to give a lot of those up. We need to still be very, very careful until we can get more of our community that are immunized.
So you brought up masks. I'm going to ask because I'm going to stay out of the political side of this, but masks are not guaranteed, but they do help reduce Could you just explain to people, because there's an amazing battle that goes on social media about masks don't work. Could you just explain, maybe in simple terms, why it's important to wear your mask?
So, this has been confusing because early on we didn't have masks. We weren't exactly sure how this virus spread. We didn't know whether it was aerosol, meaning it hangs in the air for a long period of time, or just by respiratory droplets. And so there was confusing information out there. The bottom line is the only reason we would ever recommend not wearing masks is because in the very beginning, we didn't have enough surgical masks and N95s and KN95s, and we needed our hospital personnel and our frontline first responders and our long-term care personnel to have those. These cloth masks that we wear that are, a couple layers thick, they really do prevent me when I talk, when I sing, when I laugh, from releasing particles that could infect you, Mayor, or someone else at that same time. And again, because we know that about 40 to 45% of people in our Fairbanks study, when they tested positive, were actually reporting that they were asymptomatic at that time. We know that it can spread before we even show signs or symptoms. So masks work. I always said masks, work to protect other people around you, and their mask works to protect you. But actually, the mask that you wear probably helps to protect you also. So I think, Asian populations for a long time have worn masks during the influenza season and other seasons. We saw minimal influenza this year, and we saw almost no RSV, which is what typically infects a lot of our youth and puts a lot of our preterm babies back in the hospital and can even lead to death. So I think masks, in my mind, I may wear them as I age, as I go through the airport and do other things just for influenza and other things in the future during the fall and seasons when we typically see these infections.
So somebody that believes that, hey, the long-term effect isn't there, said, nobody really has long-term effect from the vaccines, from measles, chicken pox, and so forth. Is that a fair comparison, that, hey, the vaccines you had as a child, you haven't seen long-term, you can expect the same with this?
Right. I mean, we always new vaccines. We're always watching them very carefully, and that's why this is a credit that we're taking the pause on the J&J, that our vaccine adverse effects registry system works. And that's why it's so important to report those. And they are constantly under surveillance. So as this individual is saying, we have had lots of vaccines that have been used in lots of individuals for years and years and years now, very, very safely. So we don't have any expectation that these vaccines would have any long-term consequences any different than the other vaccines that we use, as you say, for measles or mumps or human papillomavirus or whatever.
So with that, also some other questions. Can you receive COVID 2 weeks, or more importantly, I think the question is, have you seen cases where somebody after their 2 weeks after their second vaccine, have they come down with COVID?
We have in the state of Indiana about 488 what we call breakthrough cases. And I think the important thing to know about that is that we look at every one of those cases very carefully. We determine when they got sick compared to when their vaccine was what we consider totally effective. So 2 weeks past that second dose. And we look at the age groups of those individuals. And I think most importantly here, they represent about 0.04% of those individuals who have been fully immunized. So again, a tiny, minuscule part of the population that's fully immunized may subsequently get infected. In the past, we have seen as much as maybe 3 to 5% of non-responders to certain vaccines. So I feel very blessed that this number is so low, and we will continue to do that surveillance here in the state of Indiana and across the U.S.
So this COVID vaccine is really the first vaccine to use synthetic mRNA technology, injecting lab-created genetic material. Is there a concern, or should there be a concern about that?
I've had a lot of people say, well, this is new technology and it goes in and it changes my DNA forever. And it doesn't. I think the important thing about this is all this mRNA does, it does not go into the nucleus where your DNA is in your cell. It actually goes into the area surrounding that called the cytoplasm. And what it does is it works in that cytoplasm to produce a protein that is the kind of protein that we see on the outside of this virus, the spike protein. And then our body sees that as being foreign, and we make antibodies to it. So our immune system reacts to it. And then that dissolves and goes away. And the next time that protein is represented in the form of a virus to us, our body goes, oh, that's not supposed to be here. And I remember that. So now I'm going to enhance my immune system response to this. So yeah, it is different technology. It's amazing technology. The fact that we could go from 14 months ago, starting a pandemic like this, and by December have vaccines that had already been tested on 60,000+ people, and know that they're safe and efficacious, and we're putting them in arms by mid-December, in my mind, is a miracle.
So this question, I'm sure it's leaning for a reason. Should hospital employers require employees to get vaccinated? I would assume we'd want people working in the hospital setting to all wear masks, but any thoughts on that? Would you care to jump in?
Right. I think that masks in the hospitals and in our clinics may become more common than they used to be. We became rather lackadaisical here in the United States about that. I will say that many hospital systems require the influenza vaccine unless somebody has a particular medical condition that does not allow that, or they have a religious-based reason that they can't take the vaccine. But quite honestly, at this point in time, with this being a newer vaccine, I would be surprised if any of our health care systems require this right now out of the gate. I do think in coming years, if we find that this becomes like the influenza vaccine and people are taking this on a semi-yearly basis to be able to make sure that we are protecting those patients that come in contact with us so that we don't spread an infection in the hospital, I think that we could potentially see that. But that's probably coming in the future years.
We do have one media question. Do we have stats Indiana-wise, I think Indiana based, on what percentage of people have been vaccinated by zip code? Is that available? Data?
We do. I have the Lake County zip codes, and we can break that down. I will say that LaPorte City, Michigan City, South Bend, Maryville, East Chicago, they were all chosen by the fact that we have looked at what percentage of individuals in those particular communities and zip codes have been vaccinated. We have looked at the percentage of minorities there, the percentage of individuals who have had cases, who have had hospitalizations and deaths, and we know where the highest social vulnerability index is, and that is why we're targeting the areas that we've chosen for this FEMA site. The main FEMA site is right there in Gary at Gary Roosevelt High School, and we are then we're doing 2,000, maybe 2,200 a day there. And then our 2 mobile units go out to 2 different sites each week, Tuesday through Saturday, to take an additional 450 to 500 vaccines out.
And just don't forget, Rural King, Maple Lane Mall, west side of LaPorte, 9 a.m. to 6 p.m. Pfizer. So that's 16 years and older. You need, for 16 and 17-year-olds, you need parental approval. But get your vaccine and let's get through this mask. I know we've got a few more minutes. Are individuals a concern of why are individuals allowed on the website to make multiple vaccine appointments at different locations? You may not be aware if they can, or is there a reason they should be allowed to do that?
Yeah, we wish they wouldn't do that, or we wish they would definitely go back and make sure they cancel the ones that they're not going to use, because then obviously that takes up that vaccine appointment for someone else. We had a lot more of that early on. Somebody asked me, which vaccine should I get, Dr. Boggs? Which is the best one? And I'm like, the one that's closest to your arm. That's the one that you want to get. So choose the site that's closest to you. We are right now making sure that any site that had J&J today or tomorrow or the next day or so, that we are able to backfill and use our Moderna or our Pfizer vaccine there. We are looking for the ACIP, so that's the Advisory Committee on Immunization Practices. Tomorrow afternoon, they'll be meeting and they'll be looking at all of the data with regards to these cases. I'm sure they'll be looking at other complications. We may, anytime a particular complication or health condition comes out, we find other practitioners around the United States or around the state that may go, actually, I think I saw a case of that. So I'm sure that there may be more cases that come out other than just these 6 cases, but the ACIP committee will be making recommendations based on those cases and the studies that they're able to do in the next couple of days.
So this is an interesting question. If a person has had an allergic reaction to a vaccination, is one brand better than another based on an allergic reaction? And I would say you need to speak to your personal physician, but any thoughts there?
Right. There are some polysorbitol, I believe, is the common component in some of these vaccines that people can have an allergic reaction to. So really what we ask you to do is to talk to your healthcare professional about what exactly that condition was like. It is one of the questions that we ask at every site of every person is, have you had an allergic reaction before? And specifically, have you had an allergic reaction to a vaccine? It doesn't mean you can't get this vaccine, but it does mean that we want to be extra careful about where we give it, when we give it, and that we're prepared. We watch that individual a little bit longer than we would any other individual.
And so the important thing about this vaccination as well, whether you're a US citizen or not, you can drive up, receive your vaccination, and there are people every day living in our community, and that's not the argument. Our argument is we want to keep everybody that's living here safe so we can move past and beyond here. Um, so we want to be the healthiest and best place to live, as Laura Konechny has reminded us. And a couple last questions here. By the way, you will be back May 4th through the 8th for the second shot. If somebody misses the opportunity to be vaccinated this week, are they allowed to come on that second week to receive their first shot and then be up to them to find a second shot somewhere down the road?
We'll certainly try to accommodate everyone that we can at that second time, but we will have other sites that we can arrange for them to get that vaccine if for some reason they can't do it the second week that they're back.
And then is there any concern about FDA not approving this? What does that mean? Because this is only on an emergency use approval again. I wasn't sure if we talked specifically about this, but just because it's not FDA approved, any concerns there?
So I think the important thing about an emergency use authorization is all of those same phases, all of that same research, all of that same data that we have in every other medication and every other vaccine that the FDA has ever approved has been presented for each of these vaccines, or we would not be putting them in arms right now. We just need them to be out there and have more real world experience before, so that we know how long they protect an individual, that we know whether maybe it's elderly people that are not as protected as long or younger people. And then we can bring this under a full approval from the FDA. So I don't want anybody to think that they have not been through this rigorous assessment of all of this data and information, because they have, and they've been tested on between 40 to 60,000 individuals. And now we have even more real world experience, even right here in Indiana with, as I've already mentioned, about 3.5 million doses put in arms, and most all of those have been Pfizer and Moderna.
So, by the way, Lance Warner's great message. Thank you, Dr. Box, for everything you do to save lives. And just as a reminder, this will not alter DNA or make you
Infertile.
correct? Again,
Correct.
all right. So I know social media is an area we all are involved in, but if people have legitimate medical questions, is there an email address? Are there areas on the website at the state level that people can call to have their legitimate questions answered?
Right. So we have at ourshot.in.gov, you can get all of the data from around the state with regard to COVID cases and deaths, and you can get all the immunization data. But we have a whole frequently asked questions section there. And I would imagine that there's almost no question that an individual would have that's not answered at that site. But if it's not, they can reach out directly to the State Department of Health and to kbox at isdh.in.gov if you need to, and we'll be happy to answer your questions.
Well, we appreciate all that you've done for the city of LaPorte and our state, Dr. Box. I know you're busy, so we appreciate this 30 minutes, and what an amazing thing to allow our residents get connected to you. If anybody has further questions, they can reach me as always on my cell phone, 219-363-7293, or follow Tom Dermody or City of LaPorte Facebook page. And Dr. Box, you're always welcome here. Anything you need from us, and we certainly appreciate what you're doing for us today through Saturday. Get your vaccine.
Thank you for the support of the site, Mayor Dermody. We really appreciate your partnership in this.
Have a great day and thank you.
You too. Bye now.